Sudden cardiac arrest is a terrifying reality, often striking without warning. But did you know that your body might be sending subtle signals long before disaster strikes? Let's uncover the hidden risks and what you can do to protect your heart and your life. Sudden cardiac arrest, SCA, occurs when the heart unexpectedly stops beating, cutting off blood flow to the brain and other vital organs. Unlike a heart attack, which is caused by a blockage in the arteries, SCA results from an electrical malfunction in the heart. The condition often strikes without warning, making it critical to understand the hidden risk factors that could lead to such an event. One of the most overlooked risk factors is undiagnosed arrhythmias, such as ventricular fibrillation or atrial fibrillation, AFib. These irregular heart rhythms can disrupt the heart's ability to pump blood effectively and may go unnoticed for years, especially if symptoms like palpitations or fatigue are mild. Similarly, individuals with a family history of sudden cardiac death may carry genetic predispositions, such as inherited heart conditions like hypertrophic cardiomyopathy or long QT syndrome, which increase their risk of SCA. Silent coronary artery disease is another significant contributor. While many people associate chest pain with heart problems, coronary artery blockages can develop silently over time, leading to reduced blood flow and oxygen supply to the heart. This makes the heart more vulnerable to electrical disturbances that can trigger cardiac arrest. Additionally, low potassium or magnesium levels, often due to poor diet or chronic conditions, can cause dangerous electrolyte imbalances that affect the heart's electrical activity. Another hidden risk is related to lifestyle choices. Smoking, excessive alcohol consumption, and chronic stress can weaken the heart over time, while conditions like untreated sleep apnea can strain the cardiovascular system, increasing the likelihood of sudden events. Even highly trained athletes are not immune, as undiagnosed heart abnormalities can become apparent during intense physical exertion, leading to SCA in rare cases. Finally, certain medications, especially those that affect heart rhythm, and the use of illegal drugs like cocaine or amphetamines can amplify the risk of cardiac arrest. Understanding these hidden factors can save lives, as identifying and addressing them early can significantly lower the likelihood of SCA. Sudden cardiac arrest, SCA, is often thought to strike without warning, but in many cases, the body gives subtle signs that are easy to overlook. Recognizing these early warning signs can be the difference between life and death, as they often point to underlying heart issues that, if untreated, could lead to a catastrophic event. One of the most common yet ignored symptoms is chest discomfort or pain. While it's often associated with a heart attack, persistent or sporadic chest tightness can indicate problems with blood flow or electrical activity in the heart. This discomfort might not always feel severe. It can present as mild pressure or an uncomfortable squeezing sensation, especially during physical activity or emotional stress. Unexplained fatigue is another key sign. If you're constantly feeling exhausted, even after rest, it could indicate that your heart is struggling to pump blood efficiently. This may be due to underlying issues like arrhythmias or heart failure. Along similar lines, shortness of breath or difficulty breathing, especially during routine tasks like climbing stairs or walking, should not be dismissed as mere aging or poor fitness. These symptoms often suggest that your heart and lungs are not getting enough oxygen, a potential precursor to SCA. Pay close attention to heart palpitations or irregular heartbeats. While occasional fluttering can be harmless, frequent episodes of skipped beats, a racing heart, or a pounding sensation could point to arrhythmias, which are a leading cause of cardiac arrest. Another overlooked symptom is dizziness or fainting. These episodes can occur when the heart fails to deliver adequate blood flow to the brain, signaling potential cardiovascular instability. In some cases, people experience swelling in the legs, ankles, or feet, caused by fluid retention due to poor circulation. This can be a sign of heart failure, increasing the likelihood of sudden cardiac events. Additionally, nausea, lightheadedness, or cold sweats, often associated with heart attacks, may also be warning signs of an impending cardiac arrest. It's vital to take these symptoms seriously, especially if they occur repeatedly or worsen over time. Seeking medical attention at the first signs of trouble could prevent a sudden and life-threatening event. Your daily habits play a significant role in safeguarding your heart from sudden cardiac arrest, SCA. While genetics and pre-existing conditions contribute to the risk, adopting a heart-healthy lifestyle can drastically reduce the chances of a life-threatening event. A cornerstone of heart health is maintaining a balanced diet. A diet rich in whole grains, fruits, vegetables, lean proteins, and healthy fats, like those found in nuts, seeds, and fish, can improve heart function and lower cholesterol levels. Limiting saturated fats, trans fats, and excessive sodium is equally important, as these can lead to high blood pressure and plaque buildup in the arteries. Incorporating potassium-rich foods like bananas and spinach helps regulate heart rhythm and prevent dangerous electrolyte imbalances. Physical activity is another powerful way to keep your heart strong. Engaging in at least 150 minutes of moderate aerobic exercise per week, such as brisk walking, swimming, or cycling, can improve cardiovascular endurance, reduce blood pressure, and enhance circulation. Strength training exercises also help by building muscle and improving metabolic health. However, it's crucial to consult a healthcare provider before starting a new exercise regimen, especially if you have existing heart concerns. Stress management is often overlooked but is vital for heart health. Chronic stress triggers the release of cortisol and adrenaline, which can strain your heart, increase blood pressure, and lead to arrhythmias over time. Techniques like mindfulness meditation, deep breathing, yoga, or even regular breaks in your daily routine can help reduce stress levels. Additionally, eliminating harmful habits like smoking and excessive alcohol consumption can significantly lower your risk of cardiac issues. Smoking damages blood vessels and reduces oxygen supply to the heart, while heavy drinking can weaken the heart muscle and disrupt its rhythm. Substituting these habits with healthier alternatives, like staying hydrated with water or herbal teas, supports overall cardiovascular health. Maintaining a healthy weight is equally crucial, as obesity is a major risk factor for heart disease. Excess body weight puts additional strain on the heart, increases blood pressure, and heightens the likelihood of diabetes, another condition closely linked to SCA. Regular monitoring of your weight, blood sugar levels, and cholesterol can provide valuable insights into your heart health. Finally, prioritizing quality sleep helps ensure that your heart has time to rest and recover. Poor sleep, particularly from conditions like sleep apnea, can increase the risk of arrhythmias and other heart complications. Adopting a consistent sleep schedule and creating a relaxing bedtime routine can have profound benefits for your heart. These lifestyle adjustments not only protect your heart, but also improve your overall quality of life. Regular medical checkups and heart screenings are essential for identifying and addressing potential cardiovascular issues before they escalate into life-threatening events like sudden cardiac arrest, SCA. Many heart conditions progress silently, without obvious symptoms, making proactive monitoring a critical component of prevention. A key part of routine checkups is the measurement of vital indicators, such as blood pressure, cholesterol levels, and blood sugar. High blood pressure, hypertension, is a leading risk factor for heart disease and SCA, yet it often goes unnoticed until complications arise. Similarly, elevated LDL, bad cholesterol, contributes to the buildup of arterial plaque, which can disrupt blood flow and trigger heart problems. Diabetes, particularly when poorly managed, significantly increases the risk of arrhythmias and cardiac events, underscoring the need for regular blood glucose testing. For those at higher risk, doctors may recommend more specialized tests. One such test is the electrocardiogram, ECG, which records the heart's electrical activity and can detect arrhythmias or other abnormalities. Another option is the echocardiogram, an imaging test that evaluates the heart structure and function, helping to identify issues like thickened heart walls or valve problems. Stress tests, where the heart is monitored during exercise, can reveal how well it copes under physical strain and detect potential blockages in the coronary arteries. Advanced screening options, such as coronary calcium scoring or CT angiography, are particularly useful for individuals with a strong family history of heart disease. These imaging techniques provide detailed insights into plaque buildup and arterial health, offering an opportunity to intervene early. Genetic testing may also be advised in cases where inherited conditions, like hypertrophic cardiomyopathy or long QT syndrome, are suspected. Regular screenings are especially important for individuals with risk factors like obesity, smoking, or a sedentary lifestyle, as well as those over 40 or with pre-existing health conditions like diabetes or high blood pressure. However, even younger individuals should remain vigilant, particularly if they experience symptoms like chest pain, fainting, or irregular heartbeats. Beyond screenings, building a relationship with a healthcare provider allows for personalized advice on maintaining heart health. They can recommend lifestyle changes, prescribe medications when necessary, and monitor the effectiveness of treatments over time. Preventing sudden cardiac arrest, SCA, involves a combination of timely actions, medical interventions, and lifestyle strategies to minimize risk and ensure rapid response in emergencies. Understanding these measures can save lives, not only your own, but also those of others around you. One of the most critical actions is learning cardiopulmonary resuscitation, CPR, and how to use an automated external defibrillator, AED. CPR helps maintain blood flow to vital organs during cardiac arrest, buying time until professional medical help arrives. AEDs, which are increasingly available in public spaces, can deliver a life-saving electrical shock to restore a normal heart rhythm. Familiarizing yourself with their operation ensures you can act confidently if someone nearby experiences SCA. For those at higher risk of SCA, medical treatments play a crucial role in prevention. Implantable cardioverter defibrillators, ICDs, are devices placed under the skin to monitor heart rhythms and deliver a shock when dangerous arrhythmias occur. Similarly, pacemakers can be used to regulate heartbeat irregularities, particularly for individuals with bradycardia, a slow heart rate. These devices significantly reduce the risk of fatal cardiac events in people with underlying heart conditions. Medications are another powerful tool in preventing SCA. Beta blockers, for example, help manage arrhythmias, reduce blood pressure, and decrease the workload on the heart. Statins lower cholesterol levels, reducing the risk of artery blockages that can lead to a heart attack or arrhythmia. In some cases, blood-thinning medications like aspirin or anticoagulants are prescribed to prevent clots in patients with conditions like atrial fibrillation. Addressing underlying health issues is also vital. Conditions such as sleep apnea, which disrupts oxygen flow during sleep, can significantly strain the heart over time and increase the likelihood of arrhythmias. Treating sleep apnea with devices like CPAP machines can dramatically lower the risk of SCA. Another essential element is creating an emergency action plan. For individuals with known heart conditions, this might include wearing a medical alert bracelet and ensuring family members or coworkers know how to respond during an emergency. Staying vigilant about symptoms like chest pain, fainting, or severe shortness of breath and seeking immediate medical attention can often prevent SCA altogether. Finally, lifestyle modifications remain the cornerstone of prevention. Regular physical activity, a heart-healthy diet, stress management, and quitting smoking reduce strain on the heart and promote overall cardiovascular health. These steps, combined with regular medical checkups, provide a comprehensive defense against SCA. With the right combination of preparedness, medical care, and lifestyle changes, sudden cardiac arrest doesn't have to be a silent threat. Protecting your heart starts with education, action, and ongoing attention to your health.